Welcome to Health Practitioner. Starting cholesterol reduction at age 30 versus age 60 can make more than double the difference in lifetime cardiovascular risk. This isn't a scare tactic, but a conclusion from the latest research published in the world's leading cardiac medical journal. Today, we're going to tell you why lowering cholesterol should start early and those golden periods for health maintenance that you absolutely cannot miss. Let's start with a shocking number. In 2022, World Global Heart published a groundbreaking study. They built a sophisticated mathematical model that tracked and analyzed the relationship between blood lipid changes and cardiovascular events in tens of thousands of people from youth to old age. The results showed that reducing LDL-C, or bad cholesterol, by 50% yields vastly different outcomes depending on the age at which lipid reduction begins. If you only start paying attention to cholesterol at age 60, your lifetime risk of major cardiovascular events, such as myocardial infarction or stroke, can only be reduced by about 27%. Sounds decent? But if you start at 50, the risk reduction jumps to 63%, more than double the protection. Even more striking, starting at age 40 reduces risk by about 54%, while those who start at 30 can cut their risk to about half of the original, approximately 48%. What does this data tell us? Time is your capital. The earlier you invest in your cardiovascular health, the more impressive the accumulated protection. It's like retirement savings. Starting to save $10,000 a month at age 30 versus $30,000 a month at age 50 still leaves the 30-year-old with more in the end, because the power of compound interest is simply too strong. Why is there such a big difference? The key lies in 4 words: cumulative exposure. First, understand what LDL-C is. LDL-C stands for low-density lipoprotein cholesterol, a protein that transports lipids in the blood. Normally, LDL-C carries cholesterol produced by the liver to cells throughout the body. But the problem is, when LDL-C concentration in the blood is too high, it infiltrates the arterial walls, where it oxidizes and triggers inflammatory responses, gradually forming atherosclerotic plaques. This plaque formation doesn't happen overnight, but accumulates over years and decades. Imagine your blood vessels as a water pipe and LDL-C as impurities in the water. If the water quality is slightly poor, the pipe won't have problems in the short term. But if this slightly poor water quality persists for 20 or 30 years, the inner walls of the pipe will start to scale, the diameter becomes narrower, and eventually it may become completely blocked or rupture. So even if your LDL-C is only slightly elevated, say 130 or 140 milligrams per deciliter, it might not seem like a big deal. But if you maintain this slightly elevated state from age 30 to 60, a full 30 years, the total damage to your blood vessels is quite considerable. Conversely, if you start keeping LDL-C below 100 at age 30, then 30 years later, your vascular condition will be worlds apart from your peers. It's important to emphasize a crucial concept here. Atherosclerosis is irreversible. Once plaques form like cracks in a wall, you can only prevent them from expanding further, but it's very difficult to make them disappear completely. This is why prevention is better than cure, and early intervention is more effective than aggressive late-stage treatment. Let's delve deeper into why lowering lipids in youth is so effective. The first reason is vascular elasticity. Young people's blood vessels are like new rubber bands with good elasticity and toughness. At this time, if you can maintain LDL-C within the ideal range, the arterial walls are less likely to be damaged and plaques have no chance to form. But as you age, blood vessels naturally harden. At that point, lowering cholesterol is like repairing an already damaged rubber band, and the effect is naturally diminished. The second reason is less cumulative damage. Atherosclerosis isn't just about plaque accumulation. It also triggers a series of inflammatory responses and vascular remodeling. Once this vicious cycle starts, it becomes self-reinforcing. Early intervention aims to interrupt this cycle before it's fully established, preventing the subsequent chain reactions. The third reason is the compound effect. We mentioned this concept earlier, but it's worth emphasizing again. Suppose you start reducing LDL-C damage to your blood vessels a little bit each day from age 30. This tiny improvement, accumulated over 30 years, grows exponentially. As Einstein said, compound interest is the eighth wonder of the world. Those who understand how to use it benefit, while those who don't will pay the price. The fourth reason is quality of life. If you start moderately controlling LDL-C at age 30, you might only need to adjust your diet, increase exercise, or take low-dose lipid-lowering medication. But if you wait until age 60 when your vessels are severely hardened to start addressing it, you may need multiple high-dose medications in combination, or even invasive treatments like cardiac catheterization or bypass surgery. Which quality of life is better goes without saying. At this point, some people might ask, I don't have high cholesterol, so don't I need to worry? This idea is very dangerous. Cardiovascular disease risk is the result of multiple factors working together, and LDL-C is just one of them. If you have any of the following conditions, you need to start preventive strategies then earlier. The first type is familial hypercholesterolemia. This is a genetic disease where patients have extremely high LDL-C from birth, and some even suffer myocardial infarction in their 20s. If someone in your family had heart disease at a young age, or if your own health check reveals particularly high LDL-C, you must seek medical evaluation early. The second type is diabetic patients. Diabetes accelerates vascular disease and is known as a vascular killer. Diabetics need to control not only blood sugar, but also aggressively manage blood lipids. Research shows that the LDL-C target for diabetic patients should be stricter than for the general population, usually recommended to be controlled below 70 milligrams per deciliter. The third type is hypertensive patients. High blood pressure itself damages the vascular endothelium, and if you add high LDL-C, it's a double blow. These two risk factors multiply each other, accelerating the rate of atherosclerosis several times over. The fourth type is metabolic syndrome. This refers to having 3 or more of the 4 risk factors: abdominal obesity, high blood sugar, high blood lipids, and high blood pressure. People with metabolic syndrome have blood vessels that age much faster than the general population and absolutely cannot wait until middle age to start paying attention. The fifth type is people with a family history of cardiovascular disease. If your parents or siblings had a myocardial infarction or stroke before age 55, your risk is also higher than the general population. In this situation, preventive health management becomes extremely important. So what should you actually do? First is regular health checkups. It's recommended to have a complete blood lipid check every 5 years starting from age 20, including total cholesterol, LDL-C, high-density lipoprotein cholesterol or HDL-C, and triglycerides. If you're in a high-risk group, you should check annually. Many people think health checkups are only for middle-aged and elderly people. This is completely wrong. Early detection and early intervention can maximize preventive effects. Second is lifestyle adjustment. This includes dietary control, regular exercise, smoking cessation, and alcohol moderation. In terms of diet, reduce saturated fat and trans fat intake, and eat more vegetables, fruits, whole grains, nuts, and deep-sea fish rich in unsaturated fatty acids and fiber. For exercise, it's recommended to do at least 150 minutes of moderate-intensity aerobic exercise per week, such as brisk walking, swimming, or cycling. Quitting smoking is absolutely essential, as smoking directly damages the vascular endothelium, greatly increasing the risk of atherosclerosis. Third is mastering the timing of drug treatment. Many people resist taking lipid-lowering medication when they first hear about it, worried about side effects and liver or kidney damage. But in reality, modern lipid-lowering drugs, especially statins, have been used clinically for decades, and their safety is very well established. Moreover, according to the American Heart Association's Atherosclerotic Cardiovascular Disease or ASCVD risk assessment tool, if your 10-year risk exceeds 7.5%, you should consider medication. We need to dispel a myth here. Taking medication doesn't mean failure, and not taking medication doesn't mean success. Medication is just a tool. The purpose is to help you reach your ideal LDL-C target. If you can reach the goal through lifestyle adjustments, that's great. But if LDL-C still doesn't come down after 3 to 6 months of adjustment, you should take medication when needed. Don't delay, because every extra day of delay means an extra day of damage to your blood vessels. Fourth is long-term, stable control. Lowering cholesterol is not a short-term task, but lifelong health management. Some people take medication for a while, find that their LDL-C is dropped, and then stop on their own, only for the numbers to rise again. This approach is very dangerous because fluctuations in LDL-C themselves also damage blood vessels. The correct approach is, once you start treatment, maintain stability, return for regular monitoring, and adjust dosage according to your doctor's instructions. Now let's break down a few common myths. The first myth is, I'm still young. I don't need to worry about cholesterol. According to the research we just discussed, this idea is completely wrong. Cholesterol damage is cumulative. If you don't pay attention when you're young, you'll pay the price in middle age. Moreover, young people's dietary habits are generally poor now, high in oil, sugar, and salt, and lacking exercise. Many people in their 20s and 30s already have elevated LDL-C. The second myth is, it's not too late to treat when symptoms appear. This idea is even more dangerous. Atherosclerosis is completely asymptomatic in its early stages. By the time you experience symptoms like chest tightness, chest pain, or shortness of breath, the blood vessels are often already 70% or more blocked. And many myocardial infarctions' first symptom is sudden death, with no chance of rescue. So you absolutely cannot wait until symptoms appear to address it. The third myth is cholesterol-lowering medications have big side effects. Better not to take them if possible. The most common side effects of statins are muscle soreness and abnormal liver function, but the incidence is actually quite low, only about 5 to 10%. And even if they occur, adjusting the dosage or switching medications usually improves them. Compared to the risk of myocardial infarction or stroke, these side effects are really trivial. More importantly, using moderate doses of statins early is often more effective than using high doses late, with fewer side effects. Let's use a vivid analogy to summarize today's content. Imagine your cardiovascular system is a house, and LDL-C is like water continuously seeping in. If you waterproof the house while it's still new, you only need regular inspections and slight maintenance, and the house can remain in good condition. But if you wait until the house has been leaking for 10 or 20 years, and the walls are moldy and cracked before you start repairing it, not only is it more expensive, but the effect is limited, and some damage is even permanent. Lowering cholesterol is the same. The earlier you start, the easier it is to maintain, and the better the results. This isn't to make you overly anxious, but to establish correct health awareness. Starting today, no matter how old you are now, you can take action. If you're a young person in your 20s or 30s, congratulations, you're still in the golden prevention period. Just develop good lifestyle habits and have regular checkups, and you can lay a solid foundation for the future. If you're a middle-aged person in your 40s or 50s, don't be discouraged. It's not too late to start now. Actively control LDL-C, and you can still significantly reduce risk. Even if you're already 60 or older, you should continue to work hard, because starting at any time is better than not doing it at all. Finally, I want to say that health is the most important asset in life, and cardiovascular health is the most important of all. Lowering cholesterol is not the exclusive domain of the elderly, but a topic that everyone should pay attention to from a young age. Like retirement planning, the earlier you start, the more impressive the compound effect. Don't wait until your blood vessels harden and your heart has problems before you regret it. Starting today, give your cardiovascular system a golden protection period and let your future self thank your present decision. Remember, lowering cholesterol should be done early, and never neglect those golden periods for health maintenance. Your cardiovascular health starts being protected today. Thank you for watching Health Practitioner. See you next time.